No one was asking, so no one was telling. More about that in a minute. There have been many times in my life where I was advocating for many different groups, like sexual abuse and assault, HIV/AIDS, interpersonal violence, and the LGBTQ2S+ communities. While I was both working in and volunteering for the interpersonal violence sector, we developed a training for healthcare workers to be able to safely ask their patients about domestic violence in their lives. Initially, we didn't know if this was working, but when the researcher shared her feedback from the workers, we learned that many were hearing stories of abuse from their patients. She told the story about an 84-year-old woman being asked about this, and she disclosed that there had been abuse in her life when she was quite young. When asked why she never told anyone, she said, "Because no one ever asked me." Clearly, this project was a success. However, while the project was still ongoing, there came a day that I had to go to the emergency department for an allergic reaction. And to my surprise, my partner and I were never asked individually anything about this. More recently, I've become part of the LGBTQ2S+ advisory group that was created to advise Alberta Health Services and its staff members on what is needed to serve these communities better. This is a Sexual Orientation, Gender Identity and Expression Provincial Advisory Council, or SOGIE PAC. It is important to us that the LGBTQ2S+ patients and their families are treated with respect and in ways that honor who they are. We've discussed many times how staff are afraid to say or do the wrong thing when it comes to these interactions, and they end up saying nothing or blurting out something phobic or heterosexist. But this makes people feel invisible, unimportant, disrespected. We've worked to establish the ways for all areas of this large healthcare organization, from the first contact on, to identify and connect with the LGBTQ2S+ communities, using their preferred names and pronouns. If there is no way for someone's identity to be communicated throughout all the areas of the system, then they will likely be dead-named or misgendered many times in a healthcare interaction. So, we've also lobbied for changes in AHS operating systems and ongoing training to support these patients' treatment needs. One of the areas we have supported and advised on is the new patient-based program coming into use called Connect Care that will allow individuals to manage how they wish to be identified within AHS, as well as have a place to access and correct their healthcare records. But here too is the need for more to be done. Instead of no one asking and no one telling, we want both the systems and the individuals who work in it to learn a new way of welcoming every patient and to commit to making the needed changes now and into the future.